Well, good afternoon, everyone. Minister Hagee and Dr. Fitzgerald will once again be joining us by telephone today. So to start today's media availability, I will now turn it over to Dr. Fitzgerald for her latest update.
Thank you, Premier. Good afternoon, everyone. I'll begin today again with an update on the number of cases in our province. Since the media briefing yesterday, we have had 15 new positive cases. All of these cases are within the Eastern Health region. The public health investigations are ongoing, and all those considered close contacts will be advised to quarantine. Our total number of cases is now 135. That's 126 in the Eastern Health region, 3 in Central Health region, 1 in Western Health, and 5 in Labrador-Grenville Health. 56% of cases are female, 44% male. By age, our breakdown is 11 people under the age of 20, 19 between 20 and 39, 22 between 40 and 49, 30 between 50 and 59, 25 between 60 and 69, and 28 who are 70 or above. There are now 7 people that have been admitted to hospital due to the virus. Of these patients, 2 are in intensive care. 4 people have now recovered. In total, we have tested 2,107 people. Of these individuals, 1,972 have been confirmed negative. I'd like to clarify self-isolation for those with no symptoms. In keeping with the recent federal order, we will be changing our requirements for self-isolation when you return to the province after travel. You may go outside, but only if you stay on your own property and can maintain physical distancing. Please do not drive in your vehicle. And I'd like to clarify a point about testing. We have guidance around who requires testing, and not everybody in a home may need testing. This will be determined by the public health investigation. What we need to remember is that the most important intervention that will reduce the spread of this virus is not testing. It's self-isolation and quarantine. And that's why anyone who is tested is told to self-isolate, and their close contacts are required to quarantine. This is the most effective way to reduce the spread of this virus. In addition, social distancing is very important as well. I want to speak again about community transmission. So yesterday I announced that we now have proof of community transmission within this province, and this is a significant development. Thank you to everyone doing their part for complying with the public health guidance and orders that I've issued. Your actions will make a difference. It is imperative we all do our part to protect our families and friends, our healthcare workers and other essential service providers, those with underlying medical conditions, and our senior population. The health and safety of the population must be everyone's top priority. The health system has been working tirelessly to ensure we are prepared to respond to COVID-19. But you must do your part. Help ensure your friends and loved ones understand that they must stay at home unless it is essential to go out. If they have questions, explain to them that this means only going out for groceries, medical supplies, hygiene products, and essential work. If your family or friends have questions, please refer them to our website at gov.nl.ca/COVID-19. You may also want to check for them so you are informed and can help them, as I know there are people who may not have the technology or may not use the internet. Let's make sure we are all doing our part to help everyone understand why public health measures are even more important now that we have community transmission in our province. If you must go out, you have to maintain a physical distance of 6 feet between you and anyone else. Be sure to wash your hands well and often using soap and water or an alcohol-based hand rub. If you must go out and you are lining up outside a store, you are not practicing physical distancing. Do not mingle with your friends. The only people you should be seeing right now are those who live in your home. There is spread within our communities. We have to assume that anyone can have this virus. So just because you self-isolate for 14 days upon returning from travel, it does not mean that it's okay to now mingle with friends. Again, you must stay home if you are sick with a cold or flu-like symptom. Under no circumstances, if you are sick with these symptoms, should you be going out to work or anywhere else. For those who may have just joined us, we have 15 new cases since yesterday's media availability. The total number of cases in the province is 135. The breakdown by health regions brings us to 126 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. As of yesterday, we know that we have evidence of community transmission. We all have the responsibility to flatten the curve. Let's be the ones who, in the face of adversity, adhere to the public health measures to protect everyone's health and safety. Do your part. It will save lives. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. Well, of course, the last thing we want to see is to see our numbers rising. Not unexpected. We've seen this trend across the country, but it's not what we want to see. We also today have 2 people in ICU. This is something that we did not want to see, so we extend our well wishes to those that are currently affected. And we also want to let them know that we have great staff, some of the best staff in this country, taking care of them. And we send our well wishes to those staff, and we wish everyone a safe and full recovery. We have been sending some strong messages about practicing safe physical distancing, and we have said that everyone must self-isolate upon entering Newfoundland and Labrador. Today, Dr. Fitzgerald outlined some more guidelines on what self-isolating means. Stay on your own property. So whether you're home by yourself and with family, friends, or even with your neighbors, I want you to take a minute to reflect. Reflect on your own actions. Ask yourself, do my actions today, do they demonstrate the practices that we want for Newfoundlanders and Labradorians? Do my actions today determine, because they can determine, and impact the life of those around me? Now, we do not want to be alarmists, but we have to be truthful with you. This is how serious COVID-19 is. Stay inside so the virus stays outside. COVID-19 only travels by physical interaction. So to help further understand what physical distancing is, today we are releasing an animation on our social media pages right now to provide you a visual understanding of what exactly we are asking you to do. Please take a look at it, share it with others, and put that practice in place. Now, speaking of physical distancing, we are seeing a lot of people lining up outside grocery stores, places like Walmart and Costco. Limit your trips to the store and only go if you need something that is essential food and supplies to you. Stay 6 feet apart. These are not meant to be social gatherings. Stay 6 feet apart. A lot of these stores also, they give you other options, online orders. They will allow you for quick pickup. So be responsible and take every safety measure that's available to you. This is not only for your safety, but for the essential workers that are working daily and working tirelessly on our behalf. And once again, we thank them for their efforts as they help us maintain food on our table. But we must also respect them and keep them top of mind. There's a lot of people that are questioning today about travel in Labrador. Now, yesterday, I had a call with the mayors in Labrador City and in Walbush. So I'm asking not only in Lab West, but also between Blanc-Sablon and Labrador Straits to only essential travel only. So if it's non-essential, do not travel in this area. The same guidelines as I expressed to the mayors yesterday means for those people traveling in Western Labrador, communities of Fermont and Quebec. Today we have checkpoints. Working with the province of Quebec and Newfoundland and Labrador, these checkpoints are set up to ensure that people are complying with these safety measures. Products that may seem cheaper in Quebec are not things like cigarettes and alcohol. Well, quite frankly, these are non-essential items. Please only travel for essential items. With that said, we have a lot of good people in Newfoundland and Labrador. And once again, I want to send a big shout out to all of you across Newfoundland and Labrador who are doing exactly what we're telling you to do. So thank you for following the health and safety guidelines that we've put in place. You are responsible, and your actions will save lives. We cannot reduce the risk of COVID-19 without you complying to the guidelines that we put in place. As an example of people who have been making some significant adjustments in their life, it just never ceases to amaze me how Newfoundlanders and Labradorians come together during tough times. This weekend, I saw many living room concerts while skimming through social media. So these artists would be people. They're professional musicians who make this for a living. People like Con O'Brien, Alan Doyle, and Damien Follett. Making music is how they make a living. So then there are others, people like Reggie and Abigail Snook from Arbor Breton, who last night had 3,000 viewers listening to their music. So music can be so beneficial to our overall health and well-being, certainly during stressful times. Now, all of these artists are sharing their time and their talent to brighten our spirits and provide some positivity during these tough times. So I want to extend my thanks to our artist community across the province who are lifting us up with music. And that's not the only people who are lifting our spirits. The Salvation Army, an organization that always answers the call in our communities. In Port aux Basques, they have teamed up with Marine Atlantic to offer our truckers, who we talked quite a bit about this week. These are the people that are bringing essential services and products into Newfoundland and Labrador. So last night in Port aux Basques, we saw 44 of those truckers delivered and given a homemade meal, a hot supper, as they continued on their journey. These are great examples of the definition of communities within Newfoundland and Labrador. People are coming together to help one another while keeping physical distancing, safety at the forefront. These are the stories that, well, they warm our heart during these challenging times. So let's keep it going. So while we see these acts of kindness throughout our province, at the same time, we know there's a lot of information coming your way. And I can appreciate that it can be overwhelming. We have a number of resources that are available to you, depending on your needs. So we ask everyone to visit the COVID-19 website at gov.nl.ca/COVID-19. That's where you will find the most up-to-date information. It's daily updated. Also, you will see some questions that are just frequently on your mind. There's a section there to help you and your loved ones. We also have a 811 Health Line website. There's a self-assessment tool. Take a look at it. There's some valuable information that can support you. And of course, the Canadian Red Cross. They have a helpline that's been set up to help those that are in self-isolation. These could be visitors or could be Newfoundlanders and Labradorians. We are now heading into week 3 in our province. There has been a lot of people that have been working nonstop around the clock to keep you safe. So let's continue to look out for one another. The best way, as Dr. Fitzgerald said, to do that, the best way to do it is physically stay apart. Stay home, stay 6 feet away from others. The time is now. What we do today determines that the virus dies and will not continue to grow. So let's take a hold of it, not allow it to take a hold of us. Practice safe physical distancing, 6 feet apart, no matter what you're doing on your daily activities. I will now turn it over to Dr. Hagee for a few comments.
Thank you very much, Premier. I think given what Dr. Fitzgerald and the Premier have said, it's worth pointing out that we are just at the beginning of this, even though we're now entering our 3rd week. What we do now will determine how our next 3 to 6 to 9 to 12 weeks will pan out in terms of the health and well-being of the people in this province. Single biggest comment I'm receiving is that people are still going out to stores in groups. Once upon a time, we would have a family trip on a Saturday or a Sunday, and when my girls were little, it was the thing we did, and we'd go round and we'd browse. This is not the time to be doing that. What we have to do now is realize that going out is only for essentials. So it's one member of the family, you do the week's shopping, and you observe the rules. Stores, particularly the big ones, do have a limit on numbers. Even the small stores have that now. The gas bar in Whitburn, 5 people only. Mr. T's in Gander has a superb setup with directed flow, and you stand on the marks, and you are 6 feet apart. That is an absolute minimum. It is no point in being good and staying at home if you then go and undo that when you're going out for a browse round one of your favorite large box stores. That is not going to get us anywhere at all. The staff in the stores are there because they are providing an essential service. They run a risk because they don't know who they're going to come into contact with. We, as citizens of this province, need to respect that, recognize it, and give them a break. The virus only moves when people move. If you don't move, it cannot. Stay home, and certainly do not go out if you have any symptoms at all. Premier and Dr. Fitzgerald have referenced 811 and our self-assessment tool. I mentioned 811 yesterday, and indeed after the news of the possibility of community transmission, we went with a significant spike to calls for 811, and we now have over 200 people waiting a call back from a registered nurse. They will get a call back. Stay by your phone and answer it even though you may not recognize the number. Public health will not leave messages because of privacy concerns. One of the other things which never occurred to me was that there is a special line for the hearing and deaf community, and it is called a TTY line. If you do not have a TTY machine, you shouldn't be using this line. And by doing that, you are blocking access for people who have hearing impairment and need that service to access the same services you want. Please respect the principle that a TTY line, a hard of hearing line, is for people who are affected with hearing issues. One of the things that we've heard now is we've seen numbers of patients admitted to hospital. We have spent nearly 2.5 weeks preparing for such an eventuality. Our beds are free. We have staff to staff them, and the best care staff in the country prepared to do that. The RHAs are ready. They have plans in place, protocols in place at every acute care facility that has an emergency department. So if you do find yourself in the situation of needing care with COVID-19, every care facility in the province is prepared. In terms of long-term care and the other facilities the RHAs have responsibility for, we have put these under a form of lockdown. It has been a distressing and inconvenient time for families and for the people who live in these facilities. The facts of the case are it was done for their protection. But again, should the virus get in, there are protocols in place to manage that. We are well equipped in terms of ventilators, in terms of ICU beds. We're better equipped than a lot of major metropolitan cities because of our demographic. We've had to be self-reliant. We have more equipment on the way. We're working with our federal and national counterparts to make sure that our consumable supplies, PPE, are safeguarded. We've even brought in private entrepreneurs who actually have volunteered their expertise. These are world leaders in their fields of logistics and procurement, and they're working in the background to try and help us too. So what I would say to you again now in closing is exactly what I said yesterday. Make a bubble of protection for yourself and your family. Stay in your bubble and don't burst anyone else's bubble. The time to get this right, the time when we can make a difference is now. Do not miss that opportunity. With that, I will close and hand it back to the Premier.